Hello everyone, let's talk in detail about this procedure called tummy tuck or abdominoplasty. Whether it's men or women, tummy tuck or abdominoplasty is not just meant for women alone. It could be done both for men and women. And there are different types of abdominoplasty. It could be a mini abdominoplasty, or it can be a full abdominoplasty combined with liposuction, or abdominoplasty which is combined with umbilical hernia repair. So there are different types of abdominoplasty. So what are the steps that are involved in this procedure? First, there is removal of fat in the plane between the muscle and the skin. That's the first step of the abdominoplasty. After the fat is removed, the muscle in the center, which is called the rectus muscle, which gives normally the six-pack or shape to the center abdomen, is actually tightened. That's the second step of the abdominoplasty. Then all the excess skin that is there after the skin is pulled and tightened, the removal of the excess skin. So these are the major steps of the tummy tuck. That is removal of the fat, correct tightening of the muscle, and removal of excess skin. Now in between these procedures, we also do what is called, if someone has a hernia. Hernia is there is a defect between the muscle through which your intestinal contents are protruding. So then we also correct the hernia and tighten the muscle over it. If the defect is huge, you may need what is called a mesh repair, because there is a huge defect and the muscle is very weak, so we may need a mesh on top of it to give another layer of strengthening. So first fat removal, then muscle tightening, and for people who have hernia correction, then muscle tightening, and if required a mesh, and finally removal of the excess skin. Usually the procedure takes anywhere from 2.5 hours to 5 hours. A patient is usually admitted overnight, and if the recovery is good, then they can go back the next day, or 2 to 3 days of admission with or without drain tubes, and then in 2 weeks usually the suture line heals well. Now what are the complications that you can get after tummy tuck? So rarely these days we do not put drains for most abdominoplasties or tummy tuck, and sometimes we do put drains, and if there's a drain that is inserted, we remove after a couple of days. But with or without the drain, you can have collection of either blood or fluid in the space between your skin and the muscle. So if it is there, if it's the fluid, we just put needle and aspirate them in the post-op period. And if there is fluid that is collected for a longer time, rarely someone can get infected. The suture line can get infected. But the treatment for all of these are very simple. It's either aspiration or some antibiotic treatment. And rarely women who are smokers, who are diabetic, can have little vascular compromise to the skin just above the suture line. So what happens is, after doing good liposuction and skin removal, the rest of the skin is stretched and sutured. So the terminal blood vessels, if they are constricted because of chronic smoking, diabetes, extensive liposuction, there could be many reasons. The skin just over the just over the suture line loses its blood supply, and that's called what we call a flap necrosis or an ischemic area. And the treatment for the same will be waiting for that area to demarcate, then remove that dead skin, and then allow the wound to heal just by dressing or some assisted special dressings, and the whole suture line heals back. So tummy tuck or abdominoplasty is generally a very safe procedure. Women after multiple pregnancies, they have extremely lax muscle, loose skin, and they think doing non-surgical method can tighten the skin or make their tummy flat. That's not true. After multiple pregnancies, or if you had big babies and the skin is very loose and the abdomen is bulgy, the only treatment that could give you a flat abdomen is what we call a lipo-abdominoplasty, or just abdominoplasty and tummy tuck. Same with men who have lost massive weight. After significant weight loss, they have very loose skin, and in men most of the time it's after massive weight loss. It's just not just simple abdominoplasty. They may need what is called a lower body lift. Many a times men come with big abdomen, protuberant abdomen, thinking that abdominoplasty or a liposuction is going to solve the problem. But it isn't so. If they have significant amount of visceral fat, that is fat below the muscle, we will not be able to tighten the muscle. So, and the fat that we have very little fat just infra-umbilical, then you are better off just doing a little bit of non-surgical method only for that. However, if you have significant visceral fat, you are neither a candidate for a liposuction or abdominoplasty. You may have to follow a proper diet, exercise program to reduce the abdomen. And if you're really obese, then the bariatric surgery has to be done before we consider a tummy tuck or abdominoplasty. So abdominoplasty is not meant for just women, it's done also for men. There are different types of abdominoplasty where after you do the liposuction, if there's only a small amount of skin that is in excess below your navel, then that skin alone is removed and sutured. That's called miniplasty. And sometimes with miniplasty you can just tighten the muscle a little bit. But most of the time we do a complete abdominoplasty, we do a liposuction before, complete repair of the muscle, remove the excess skin. And in men, it's not just a simple abdominoplasty. Sometimes it's either extended abdominoplasty or what we call a lower body lift, or if you complete full 360 degree, it's called a belt lipectomy. So abdominoplasty, there are different types. If you have a concern, please meet a surgeon, discuss the various type that is available, discuss your concerns, make sure that you rule out whether you have a hernia. There will be some who has just hernia. You may have a navel hernia or you have a small hernia, and you could combine an abdominoplasty and with the hernia repair, and do both with just one small incision in your pubic area, which can extend from one hip to the other, and just another scar around your navel. Suppose someone has an umbilical hernia and the hernia comes out through the navel, your native navel may have to be removed along with abdominoplasty, and then a neo umbilicus is created. So these are all steps of the abdominoplasty.